This is Nicole Raleigh. I am web editor of pharmaphorum, and today I'm speaking with Hakim Yadi, CEO and founder of Closed Loop Medicine. Nice to speak with you again.
Lovely to speak to you.
So today you did the plenary keynote speech at Frontiers Health 2023, focused on global health, but especially bringing in the digital health aspects and equality and the technologies that are on the horizon. So perhaps to start with, you could tell me more about Closed Loop Medicine's part in this, and especially your focus today on dosage as medicine or dosage as toxicity as pertains to bringing in the individual.
Thank you so much. We often think about precision medicine as being the right drug for the right patient at the right time. But I would argue we've missed a part of that, which is at the right dose. Mm-hmm. As I was sharing at the plenary, everything that we take into our body can either be helpful or harmful, and the dosage alone makes it a poison, the famous quote from Paracelsus. And what we now have the ability to do is better understand on an individual level that response, that fine balance between the efficacy of a medication working and the side effects that come with it. Mm-hmm. And at an individual level, what we're aiming to achieve at Closed Loop Medicine is trying to find that sweet spot where the side effects are tolerable, but the efficacy is there for the individual, which hasn't been the way that we've historically approached medicine's development.
No, not at all. There's been this sort of one-size-fits-all approach, hasn't there? So bringing in the data aspect now, because it's all about data nowadays. What can be done there to optimise that, because there's a huge breadth of data, and better outcomes for patients?
So, years ago, people were talking about data as the new oil in healthcare, and said the value of data. Data is only valuable if it's actionable. And what we've been trying to understand is what are the data points that are actionable for a patient and a clinician to better understand their care. And so at a very simplistic level, we're looking at two extremes. Does the drug work? Does it cause side effects? An efficacy biomarker and a side effect biomarker. Mm-hmm. So in the case of hypertension, the therapeutic area that I discussed in the plenary, the two important elements for the drug that we've been working on, amlodipine, is blood pressure, mm-hmm. and then the side effects that come with it, which is patients having swollen ankles, getting headaches, getting flushing. Mm-hmm. And so we built a software platform that allowed patients to track the side effects that matter to them, the drug dose, and the efficacy, the blood pressure. Mm-hmm. And from that, we're now starting to get to a point of being able to better understand what it means to get that right for an individual, and in future to be able to predict that.
Yes, this prediction also is another sort of buzzword off the back of the biomarkers and everything. So talking about predictions, if we think of the near future and the longer horizon, say 20 years' time, where do you see efforts like Closed Loop Medicines going?
So for me, the personalisation of medicine, I think, is inevitable. I have a 3-year-old daughter and a 6-year-old daughter, and they know that they get 5 ml and 7.5 ml of Calpol. Mm-hmm. They know that dose is different even then. Yet when they turn 18, everything's the same. Mm. So in the years to come, the 3D printed pill will be delivered by the Amazon drone. And that's the level of personalisation we will see. But between now and then, I think there's so much more we can be doing with the medicines we have if we bring the technology in line with the drug.
Thank you.